doula, but we see the postpartum work has really picked up. We do a lot of work primarily with women of color because of the maternal and infant mortality rates that and the disparities that are associated with women of color. I myself am a woman of color. So we see some of the effects and how this bill could actually be such a great benefit for the moms and the families that we support. We have a primary postpartum doula on our team currently that she is still postpartum, doing postpartum work with moms a year and a half later. So just to think that they're considering extending for a year is amazing. Some of the services that we provide as postpartum doulas is we come into the home right after the mom delivers. We support her with light housekeeping. We support where she gets her rest, and we care for baby while she's resting. We continue the breastfeeding cycle if that's what she's chose to do. We help do light housekeeping. We run errands, and we're also there as a sounding board. And when I say sounding board is we gauge what is going on with mom throughout the whole time that we're there. Most times and quite often, we pick up on the signs of the postpartum depression. We pick up on the signs of when she's talking to us and she's just not feeling right. And because of the relationship we have with the clinic, we can encourage her to get in contact with her primary care physician. And most times she does, or we'll make the connection for her, you know. And yes, the postpartum is real because we have partners who are also there in the home and they don't see it. They come to us and they're like, well, why is she acting different? And why isn't she able to, why are you doing the dishes? And this is something she should be able to pick right back up. So you can also see that the understanding is not there. So we're also there to support and bridging that gap of understanding and encouraging other family members to take a lead into supporting her. It's not easy after having a baby and really coming home to transition to have a newborn, especially if you have other kids in the home. And that's where we see a lot of support being needed around the family structure in itself, getting that adjustment started and encouraging them to seek help. Because the one thing that we've noticed is they usually reach out because they don't know what's going on. You know, they call it baby blues, call it all these other things, or you'll step back out of it. You know, they have friends who say, oh girl, it's okay. You know, it happened to me too, and back on my feet within a matter of days. And sometimes that's just not necessarily true for every woman. So that's what we do here in Sistas Camp for Sisters. And if you have any questions, feel free to ask me. I'm an open book.
Cindy, thank you so much for sharing that, your important, wonderful work. We really appreciate you opening up our conversation here today, talking about that. And our internet at the office is back up and running, and I am going to turn things over to Kaylan Szafranski right now as we move forward. Kaylan.
Good morning and happy Friday, y'all. Of course, it wouldn't be just a typical day in this day and age if we didn't have a last minute shakeup. So glad we have the internet back and we're doing great. Thank you so much, Cindy, for providing just such a critical perspective and really emphasizing that the postpartum period is not only so important for our children and our moms and babies in general, but really, what happens during that period varies so much, which is why we have to think about care on a continuum, right? That this is the start of what sets us up for the rest of our lives. So while I am getting everything together, I wanted to just kind of kick us off about the state of the state, as it were, for postpartum in North Carolina. So NC Medicaid provides so much for so many, as so many of us on this call know, right? But as you can see on this slide, it is a literal lifeline for over half of the births in our state, which means that this program serves moms and babies, just like Cindy said, during the most critical period of life, which is that postpartum period, when mom and baby are at often increased risk of debilitating health issues like bleeding and blood clotting. One that flies under the radar a lot, like we were just talking about, is depression, which can really significantly disrupt the ability to develop those healthy bonds that are necessary for optimal well-being across the lifespan. And I would be remiss if I did not point out the staggering racial disparities between Black women and infants who are twice as likely to die than their white peers. So there's a lot at stake during this period of life. There we go. All right. Continuing our trend of doing great. So what does postpartum coverage look like right now? So the current program provides care related to pregnancy for Medicaid eligible women, but as you can see, it currently ends at 60 days postpartum. And for all the reasons we just talked about and for everything that Cindy brought up for us, we know that we can provide better support for lifelong outcomes if that initial care is extended through that first full year of life, because it really allows everyone to get what they need to develop optimally and ultimately thrive in society. Again, thinking longitudinally about this is really important. All right, and while we are so excited to have both Cindy join us and of course, Senator Burgin, who is going to walk us through an amazing opportunity for moms and babies across the state. But before I kick it over to him, I just want to talk about why this is so important now. So as you saw again on my first slide, we have one of the highest rates of infant mortality in the nation. And recent federal legislation is really making it easier for states to extend this period of postpartum coverage under Medicaid to 12 months so that families really have what they need to be healthy, thrive, and live their life with dignity from the get-go. And I just want to point out kind of two pieces that people don't often think about when we talk about postpartum health and care, which is one, addressing chronic issues. So things that happen to both mom and baby in that first year of life, if they go unaddressed, they can turn into issues that follow them across the rest of their lifespan. So of course, for babies, we know, preterm birth, low birth weight, all of that stuff can really impact development. But I don't think a lot of us think about what happens when mom has some complications or concerns during pregnancy, and how at that kind of 60-day benchmark, if they were getting treatment for something that happened during pregnancy and all of a sudden that treatment drops off, we are making it more likely that that could turn into a chronic issue longer term and really prevent that mom from being able to care for her family, care for herself, and ultimately thrive as that family unit. And then the other piece that I think is, again, a little bit different when we're thinking about early health, but it's school readiness. And when you think about health as kind of a long-term longitudinal goal, it makes sense that the health that's achieved right at birth and even beforehand is the underpinning for things like learning and school readiness and having that lifelong ability to attend in school and thrive cognitively and be able to self-regulate. All of those things start happening during this postpartum coverage. And so the earlier we can intervene and provide all of the right supports and scaffold that child's development, the more likely we're going to achieve what we want. And so it's really just another opportunity for us to invest in our futures by supporting development early on. And so with that, I am going to stop sharing my slides. Happy to answer any questions y'all have, but of course, really can't wait until Senator Burgin walks us through what he has.
Thank you, Kaylan, so much for that great presentation. And I'm really happy also that the internet was back up so we could see your slides, and so that I get to take over from Adam because I get the great honor of introducing Senator Burgin today. So we are very honored to have Senator Jim Burgin here with us today. Senator Burgin is in his second term in the North Carolina Senate, representing District 12, which includes Harnett and Lee counties and some of Johnston County as well. And he chairs the Senate Healthcare Committee as well as the Senate Appropriations Committee on Health and Human Services, along with colleagues Senators Kravick and Perry. Senator Burgin is a lifelong resident of Harnett County, and he's the current president and owner of C&D Insurance. He previously served as chairman of the Harnett County Board of Commissioners. Most importantly, Senator Burgin and his wife have 3 children and 4 grandchildren. So Senator Burgin, thank you so much for being here with us today. I'm going to ask you some questions about Senate Bill 530, and we'll continue with our presentation. So our main focus in inviting you here today was to talk about this important piece of legislation that you're sponsoring, Senate Bill 530. It's called Medicaid for 12 months postpartum. Lots of folks on this call have been following this bill with a lot of eagerness. Many folks, don't realize that for new mothers who qualify for Medicaid due to their pregnancy and their income level, they currently often lose that coverage 60 days after giving birth. So this bill would extend that to 12 months. And this is so important for all the reasons that Kaylan and Cindy just described. So Senator Burgin, our first question is really, what really made you want to sponsor this legislation and why you think it's so important?
Well, first of all, it's a pleasure to be with you. Thank all of you for taking time to be with me. Now, I'm actually at our place at the beach, and so if you hear some kids come through after a while, that's our grandkids. They're all here, and they're out on the beach right now. But they I've been in the insurance business for over 32 years, so I've dealt with folks. I've looked at what happens to folks, and being a parent of 3 millennials and now 4 grandchildren, and 2 of those are daughters, and I just saw a real problem with this. And when I got to, let me back up a little bit. I've served on a hospital board I was on a hospital board for 15 years. I served on the state SHIC, the State Health Coordinating Council, that handles all the CONs. And so I've been around healthcare and looked at healthcare, and so I went to Raleigh, and I specifically asked. I said, I want to be involved in healthcare. So they put me on healthcare the first year. I actually got to serve as one of the chairs anyway, I got to serve and help on the budget, and so I got a kind of a jump start into it and started asking a lot of questions about what are we doing and how are we doing it. And this past year, 54% of all children born in North Carolina were born on Medicaid. And I just want to say to those moms, thank you for making that choice rather than choosing to do something else. I think, and I really want to help those women that will make that choice to have a baby. And so as we started getting into it, I started looking at all these factors, infant mortality, and I'm a statistics guy, so I started getting all this data. And I saw what it is in the Black community, about 12.8%. The Hispanic and white communities, close to 5%. And I said, well, we can't have that. That's not a good relationship. And so I went to Senator Berger and I said, I really want to look at this. I think this is something we ought to do. And he said, do it. He said, go work on it, figure it out, and see what you think we ought to do. So I did. And talking to Dave Richard and all the folks at DHHS, and again, getting more statistics. And I serve on the Child Infant Mortality Task Force. So I started getting a lot of data from them and just talking to a lot of folks. And I see Tara Fish on here, who I just think so much of. And Tara and I have talked about a lot of things over the years. And Ashley Pattison, I know she's on here. And Ashley does a great job of representing you all and bringing these things to our attention and coming by to visit. So all of this came to the conclusion that 2 months is not enough for us to provide health care for women. As I said, being a dad and going through with Ann and our 3 children, and then our daughter and her 4 children, I just think that that's really important. I don't want that to be a factor in a mother not taking care of her child, is not being able to take care of her own health. So I said, I want to run this bill. So we've run it. We've actually put it in the budget too. So we're going to get it over the line. And I also want to provide community college to those women during those 12 months, because the best thing we can do for someone that's on Medicaid is give them a path to become self-reliant. I want to get them from a dependency on something to a place where they can prosper and take care of them and their children and their family. So it's a big thing. It's going to be real involved. I'm actually going back to conception and looking at what we can do from conception forward to give these kids and moms the best opportunity to move forward. And one of the things we've got to get a handle on is the diet in North Carolina. I'm getting all the statistics right now. They're coming to meet with me next week. I've been working on it and having trouble getting the data, but they're coming to visit with me next week. I've asked for information on all the EBT money that's spent in convenient type stores, including Family Dollars and all of those folks. Because one of the things I found in looking at the disparity in the infant mortality is a lot of the EBT money is being spent there. And we all know that a lot of the food that you'll buy in one of those kind of stores is high in processed sugars and nitrate, sodium nitrates. And, I saw there's a huge disparity, I think, in when you look at obesity, diabetes, hypertension. So we want to look at all of that and figure out how to get these newly expectant moms great nutrition, make sure they take their prenatal vitamins and go forward. So it's going to be a big thing, but I'm planning on staying there a long time and getting this fixed. I'm committed to it. We're also doing a lot of things in the budget as far as childcare, and we're looking at some programs right now. I was on the phone with a couple of senators this morning about a back to work program where we're going to try to do more on childcare and put more money toward childcare, because somebody can't take a job if they're worried about who's going to look after their child and is their child safe. So I want all of us to be working together, figuring out how to do this. I don't have all the great ideas, but I'm willing to work with anybody to try to improve health for women and babies. And also, I've got a bill that has already passed the Senate. It's going to the House. Should pass the House in the next week or two. We're going to be doing a lot more things through our pharmacies. A lot of people can't afford to go to the doctor, so we're going to be doing a lot of things in pharmacy, including offering hormonal contraceptives for women. Because I'll tell you, one of my goals is I want to reduce the number of abortions in North Carolina by 50%. And I'm not talking about Roe versus Wade. I'm not talking about any of that. I just want women to be able to make choices and options. And if one of the best things they can do if they don't want to have a child is to have the ability to have the proper prescriptions to not get pregnant. So it's kind of a big puzzle that we're putting together. It involves a lot of activity, a lot of people. But I think there's some really good things that are happening, and I want to see those results. So we're going to try to drive infant mortality in the Black community down 5 points in 2 years. That's one of my goals, and if we do that, we're going to, by doing that, we're also going to drive it down in the White and Hispanic community just by the very fact of what we do and how we do it. And I'll be happy to answer any questions.
That is an awesome goal, Senator Burgin, and really great to hear you talk about all the different initiatives that you're working on. Really appreciate that. While we're talking about Senate Bill 530, the Medicaid extension for postpartum, I wonder if you could talk just a little bit about what are the next steps for this legislation, what's the timeline, and how can all the advocates for families on this call really engage to support getting that bill across the finish line?
Talk to people. I encourage everyone to, as you talk to anybody in the House or the Senate, talk about it. As I said, we put it in the budget. We have finished the Senate budget. We're waiting on the House to give us a number to agree on, and then they will work on the budget. So July 1st will be here before we know it. I would love for it to go into effect July 1st. So we're going to actually, we're looking at it that way. If the budget slows down, we're going to start doing some mini budgets. And if we do, then I'll try to run it through that. But one way or the other, we're going to get it done. And I have commitment from leadership that they're behind it.
Well, that is just fantastic news to hear. So of course we've got work ahead of us, but so glad to hear you've been working really hard on this to make it happen. And we're all so appreciative. I think we've got a couple of questions, and I think Tara Fish is on the line. Tara, I don't know if you had a question that you wanted to ask Senator Burgin while we're all here. And if not, I can jump to folks in the chat.
Yes, I actually do. So Senator Burgin and I have known each other a long time. He's heard a lot of my thoughts on how we can, impact children overall. And he knows me very well. I get it from my dad, and Senator Burgin knows my dad as well. So, but one of the things about Harnett County is that 4 out of 10 of our babies are Medicaid babies. They are babies born to that. So in a lot of rural communities, it's more than 40%. It's actually 50% in rural communities. So how do you see this expansion of Medicaid affecting our local community, because you are our elected representative, and then other rural communities as well? I mean, I would love to know your thoughts about those pieces. You see it impacting our overall rates of child maltreatment, or lots of different possibilities, but what do you see as some of the biggest benefits to that for this expansion for us as rural communities?
Well, one of the problems we have in rural communities right now is healthcare. I mean, we've got 3 counties that don't have a primary physician, and we have 30 counties that don't have a psychiatrist in them. And so part of it is availability of care. If we have them on Medicaid so that the provider will be paid, then the question is, how do we get them in front of a provider? Tara, I was on the phone with John Roush this morning at 7 o'clock. John's our health director in our county, and he and I had a couple of things that we were working on and he wanted to talk about. And so I think that's part of it too, is getting everybody thinking about the same thing, talking about the same thing, and working toward the same thing. What I've learned about politics and being in Raleigh is there are so many different groups and so many different initiatives and so many different programs that it's hard to get all of those folks together. I'm pulling a group together Monday to talk about this pharmacy bill I mentioned. Well, right now we've got 21 people that have already signed up to come, representing different groups and organizations, but that's what it's going to take. Is having, I call it, getting stakeholders together. And I think that's what we've got to do, because the problems that Harnett County have is not the same problems that Mecklenburg or Wake has, or the same problems that Bertie or Stanley County have. So there is not going to be a one size fit all, but we got to get more things done. And I'm a big proponent on growing your own. I want us to grow more of our own primary doctors, more psychiatrists. I want to look at funding an extra 10 primary care doctors and 10 psychiatrists that will go to tier 1 and tier 2 counties, and the state fund them, pay for the residency and everything, to get these folks out in the community. Do it like we do the teaching fellow program, where that they're obligated to work in those counties for so many years. And I tell folks, if we can get them to one of these rural counties and get them married to a local person, they probably will stay. So that's one of our goals. Is that I told people we may have to set up a health committee matchmaking service to try to get these folks to stay, because we want people to get out in the rural communities, fall in love with them, and stay there and provide services. But Terry, back to your point, it's the rural health departments. We've got to do more through our rural health departments, and we're sending them a lot of money. We've got a lot of money going to a lot of different programs from the COVID. We still call it COVID money. Now it's the recovery money, but we've got a lot of things that are going to be doing programs in childcare, services. Yesterday, I discussed rural health departments and rural health clinics.
Fawn, I think we might have lost Senator Burgin.
Oh, we lost audio.
Am I back?
You back?
And now he's back.
Good.
I'm sorry. I don't know what I was saying when I did. Am I speaking in French? I wanted to know, can we play mine in French? That was an option at the first, and I've never spoke French, so I think that would be pretty neat.
Yeah, let's try that on the next call.
Yeah, we'll try that. We'll listen.
I think we've got time for maybe one more question before we let you go, Senator Burgin. Cindy McMillan, do you have your hand up to ask a question? Do I see that?
Yes, you do. Hi, Senator Burgin. Nice to meet you. I'm just curious, as a doula, and I am a birth doula, a death and bereavement doula. I'm a North Carolina peer support specialist. I'm a childbirth educator. And what we've noticed in this work is, and especially in my community, and the woman, being a woman of color, like in our Black community, we have to build trust. And we know that this postpartum extension is going to be great, but moms, they don't know half the time that they're even going through postpartum. They don't know what it is. They don't know what to call it. They don't know what to label it. I myself, when I had my kids, I went through it and only realized what it was when I started doing this work. So if there is a mediator in between, like a doula, I mean, we have been proven to bring great benefits, especially in the birth outcomes. But in the postpartum period, we are the ones that's actually in the home, and we're the ones that's seeing their chaos, what they're going through, and as we pull these providers in, and your suggestion was like spot on, getting a cohort of providers and getting mental health professionals in, you still gonna need that middle person, and that's just a suggestion. You don't have to be a doula, but you're still gonna need that person inside the home to actually encourage and help guide that mom to take the leap, to go for it with seeking out help, especially if it's masked by what friends and family may deem as, oh, this is normal. And it is normal in a sense, but it's debilitating when it prevents you from living your everyday life. It's debilitating when it's preventing you from bonding with your child. And we see that. We see a mom, she's so overwhelmed that she can't even pick up babies. So then the doula steps in and create that bonding connection that normally should be there automatically. So this postpartum period is like really, it's a serious thing when you're really in the work and you're really in these homes with families and children. So I just think that as you consider these pieces, consider another piece of having an individual that can support the mom in the home too, as well, to get her motivated. Even college, for what we're proposing about higher education, that's great. She has to also want to be motivated and know that, you have someone having your back over here. We have a whole team, the healthcare team, whatever you need. And that reassurance goes a long way because we've seen it work in action over here.
Well, as it says in the Bible, that on a journey, if you have someone with you, if you stumble, they're there to help you up. And I think that's, all of us need somebody alongside of us when we go through things in case we do stumble. So I am looking at all possibilities of how we help women have great outcomes. I want them to have a wonderful birth and have a healthy child. The number one reason listed on death certificates for in the Hispanic, in the Black community for the death of a baby is low birth weight, and that involves a lot of things. So that is important. So I want to have a healthy baby, and then I want to help that mom get over that period. And look, I'm not an expert on it, but I've like I said, I've been in the insurance business and had helped talk to people about healthcare for over 32 years. So I've heard stories, I've seen stories, and I think that there's a way for us to do this, to get these moms through that period, however long it is. That's why I wanted it to be 12. Some people wanted to do 6 months. I said, no, everything I read says we need to do it 12 months. And so that's what we're going to do. We're going to do it for 12 months. And then we're going to start pulling in data. And that's where everybody's going to be so important, because I want to be able to go back to my peers and say to them, look at these statistics. We've done this. Now let's invest more in this, because every time we are successful, we're actually driving costs out of care that we can turn around and reinvest to even make it better. So I'm not one of those that says, let's just take money away from stuff. I'm all for investing in outcome.
Well, Senator Burgin, thank you so much. It's been just an absolute joy to hear your thoughts on this and to see the way that you are pulling people together and listening to the experts, listening to the data, and you are brave in your choices, and we are just grateful for the work that you're doing. So thank you so much.
Everybody pray for me. Keep me on your prayer list.
We pray for all of our state legislators, Senator Burgin.
And come visit. I love for people to come visit. So come to the office and visit. Be happy to talk to you all, and anything I can do for you, give me and pray for Tara's dad. He's been through a whole lot, and he's home now. And Tara, I saw some pictures of him this morning, and him being outside and stuff. But continue to pray for her dad.
Yeah. Thanks, Senator Burgin.
Thank you all. Y'all have a wonderful rest of your day.
Thank you so much. You too.
Bye-bye.
Great presentation, everybody. So grateful for our guests, and want to thank all of you all for sticking with us through our technical ups and downs here. I don't even know if I introduced myself earlier. I'm Fawn Pattison. I'm campaigns director here at NC Child, just jumping in and out as our internet came back online. So thank y'all for bearing with us. We are going to move into our legislative update, and I see a couple questions in the chat that actually fit well with the legislative update. So folks, I think you're going to get your questions answered, but if not, we'll circle back. So I'm going to introduce our policy director, Tiffany Gladney, and she's going to take over with our legislative update for the week. Tiffany.
Good morning. Happy Friday, y'all. I almost went into the office today to do this call, so I'm really glad I didn't actually. So, this week, we did see Governor Cooper release his recommendations for the American Rescue Plan funding, which, by the way, North Carolina is slated to get $5.7 billion in flexible state aid. And some of those highlights within Governor Cooper's proposal include a $1.2 billion investment into broadband access and affordability to close the digital divide. We also saw an investment proposal for $300 million to build the educator pipeline, expanding North Carolina pre-K, supporting high quality child care, and promote early literacy. We also saw in his plan expanding access to affordable education. For example, $350 million in the North Carolina Guarantee Scholarship for students from families making less than $60,000 a year. And speaking of federal funding, we also saw Senate Bill 172, additional COVID-19 Response and Relief Act, pass the legislature. And this, of course, is the General Assembly's proposal for how to spend a huge portion of that $5.7 billion I just mentioned. So some notable highlights from Senate Bill 172 include IDEA. I have to say it slowly because otherwise I'll lose a letter in there. IDEA preschool grants, $5.96 million. IDEA infants and toddlers, $6.2 million. Some community-based child abuse prevention at $7.6 million. And maternal, infant, and early childhood home visiting programs at $625,000. So also, you've heard a lot of talk about crossover last week and weeks prior. So you might be curious, how did the bills that we were watching or working or opposing fare during crossover? So some of the bills that made crossover that we were tracking and or working actively include Senate Bill 35, which is the maximum 4-year age difference to marry under 18 years of age. We also saw the infamous immigration bills require cooperation with ICE 2.0 and government immigration compliance and joint ordinances make crossover. Foster Parents Bill of Rights also made crossover. And when I say made crossover, I mean they are still eligible for passage this session. On the Healthy Children forefront, we saw House Bill 736, timely updates for newborn screening program, early childhood education. We saw House Bill 664, county service districts and early childhood education also pass the crossover period. So which bills didn't make crossover? but could still be included in the budget. As Senator Burgin just mentioned, Senate Bill 530 did not make crossover, but I am thrilled to hear that it's in the Senate budget, which I know you guys are as well. So that's the Medicaid for 12 months postpartum. Also the merged North Carolina Health Choice and Medicaid, that's House Bill 747. House Bill 499, which is the Recovery Rebate for Working Families Act, which would help reinstate the Earned Income Tax Credit. So these are all bills that did not make crossover, but we are still actively working in coalition with our partners and our advocates to make sure that budget writers know that these are the initiatives that need to be included in the final budget proposal that goes to Governor Cooper's desk, hopefully. So other bills of interest that are now ineligible for the rest of the session. And I say that with a caveat that please keep in mind that oftentimes bills get resurrected as other bills. So they're ineligible, but it doesn't mean they're completely dead. So those include bills that have garnered some national attention, the House Bill 358, the Save Women's Sports Act, which would restrict transgender youth from participating in school sports teams, Senate Bill 514, the Youth Health Protection Act, which banned people under the age of 21 from transition health care, and also would require state employees to gender non-conforming children to their parents. And so far, Governor Cooper has only vetoed one bill this session, and that is Senate Bill 37, the in-person learning choice for families. So on a federal side, we are thrilled to announce that the Pregnant Workers Fairness Act successfully passed the U.S. House last Friday and is now in the Senate awaiting a vote. So when you get the email update, be sure to click that link to learn more about the bill. And this bill would provide not only reasonable accommodations, but also prohibit discrimination of pregnant workers in the workplace. And this would be applicable across the nation. So this is huge, huge, huge news for working moms and families across the state and across the nation. So with that being said, it was a lot there, but Adam, Kaylan, Fawn, turning it back to y'all.
Thank you, Tiffany. And I see a question from Sloan in the chat about Senate Bill 693, expedite child safety and permanency. That was a controversial concept last year. And I don't know off the top of my head where that bill stands with regards to crossover. Tiffany or other folks on the call, does anybody want to weigh in on that one?
Let me check really fast. I still have the document pulled up. Let me check 1 second. Is there another question while I look it up?
Just going back to some earlier points, I just wanted to lift up from our previous presentation, folks were asking about Medicaid coverage for oral health care as part of this legislation that we were discussing. And I don't know, Kaylan, if you want to jump on to talk about that, whether oral health care is covered in this postpartum Medicaid extension bill.
Absolutely. So I put it in the chat, but so the way that it works is it's because part of the benefits package for Medicaid is defined in federal statute. And for Medicaid that touches adults, including Medicaid for pregnant women on that federal side, oral health is not a part of that full Medicaid benefits package. And instead, what the federal government allowed states to do is have the option for how they want to address oral health for adults. So under something like Medicaid for pregnant women, because that is such a defined and narrow eligibility category, the state has it currently set that we provide oral health for those folks in that category up until birth. So in order for us to extend that, we would have to extend the Medicaid benefit separately from what this bill would do, which is really just focus on what's called the medical benefit. So they're kind of two different benefits packages. But I will say that this is a high priority for us at NC Child. We want to make sure that women have everything that they need, including oral health. So we are really looking forward to partnering on that work moving forward. But this legislation, unfortunately, would not include that in the full Medicaid benefit package.
Great, thanks, Kaylan. Tiffany is weighing in the chat. 693 did make crossover in response to Sloan's question. And Sloan, we can check in with some other folks and get more information about that bill for you and check in with you after the call. So I don't think we have more questions in the chat. I think we addressed everything in this update. Let's see. Yeah, changes to 693. Yeah, I just don't, I do see that there was a committee substitute passed and I just don't know all the details on that bill, but we will get more information and come back to you with that, Sloan. Okay, folks, if you have other questions, please go ahead and keep putting them into the chat, and I am going to open it up to some announcements. And I'm also going to try to share PowerPoint slides while speaking, which is always a challenge, walking and chewing gum at the same time. So I do want to let you all know that we have another webinar coming up in our series on dismantling racism with data. We had one yesterday, and the one that's coming up next is going to be best practices in communicating about data on June 17th. And then our technical assistance project to improve your agency's communications about data. Applications are still open for that through May 28th. And I'll drop the link into the chat when I'm done sharing slides, because I can't do both of those things at the same time because my brain doesn't work that way. But I will do that as soon as I'm done talking. And then I think I have one more thing to show y'all. Tonight is our student mental health roundtable sponsored by the NC Child Youth Advocacy Council, and the link to register is there on your screen. And all of this information will come out in the follow-up email that we send you after the call. Next week's meeting will not be happening because of Memorial Day, but on June 4th, we're going to be coming back at you with a very in-depth presentation on American Rescue Plan funds and how those will be impacting North Carolina. We'll have a panel of speakers. We're finalizing that now. You got a little bit of a taste of it today, talking about the governor's proposal for that, but we're talking about $5.7 billion coming to North Carolina, y'all, for stuff that we care about. So hopefully y'all will be able to attend that. And I also just want to see if there's anybody else who wants to share an announcement. And while that's happening, Elizabeth Byram, do you want to talk about the child care development plan for just a second? And do you have an announcement about that?
Absolutely. Thanks, Fawn. And we're going to send an updated fact sheet that you all received last week with just some additional details. Thanks to all of you who have asked questions about the Child Care Development Fund state plan. This is a 3-year state plan, and we are coming to the end of our public comment period. So we were able to get confirmation that public comments will be accepted in written format through May 26th. So that's next Wednesday. And we will send out our fact sheet again that has a high-level summary. There's also a survey, which we'll put in the chat. It will also be on the fact sheet. You can also weigh in on the survey. So either written comments via email or the survey. Again, we're really encouraging folks to think about the hot issues now: compensation, market rates, childcare subsidy expansion, making sure that all families can access care and that providers are taken care of and really are treated as, the professionals and incredible workers that they are in this field. If you have questions, feel free to reach out. Thanks again for all you do on this work.
Great. Thank you so much, Elizabeth. So I am dropping a link into the chat for the learning series on dismantling racism with data for the upcoming webinar. And I don't think I see any other announcements coming into the chat. So I think that's it. Oh, Elaine Zuckerman, do you have your hand up to share an announcement?
I do. Sorry, I couldn't get it in the chat quickly. Couldn't find my link. But I just wanted to say thank you, NC Child, for hosting us today and inviting Senator Burgin. It was so great to hear him speak about this important bill. I wanted to just mention that the Think Babies North Carolina Alliance is hosting our 4th annual Sterling Thunder event on Friday, June 4th. I will put the link in the chat since I found it now. So, extending postpartum Medicaid coverage is one of our priorities for Think Babies. And so Think Babies NC really looks at child health, early education, and family support. And so we'll have legislators and parents speaking about those issues at the event, and some great advocacy workshops, so that we can all think babies together. So I will put that link in the chat and hope to see many of you there. Thanks.
Thanks so much, Elaine. And I want to just take a chance. Thanks to Tita for asking about how to get onto our email list to receive information. I just dropped the link into the chat, and you can sign up for what you want there. If you just want the legislative update, if you want to get our blogs, you can pick and choose. So go ahead and use that link, or if you know folks who would like to get these updates, you can send them that link as well. Elizabeth has dropped the link to the Child Care Development Fund state plan survey. So if you're in early childhood and can weigh in on that, your comments will be really valuable. And I know that Elaine is going to drop the link for Strolling Thunder on June 4th. There's the link. Okay. Thanks everybody so much for being with us today, for bearing with us through technical ups and downs. I hope you all have a fantastic weekend. No meeting next week live, but we will see you in 2 weeks to dive deep on the American Rescue Plan. So everybody have a great weekend, and we will see you soon.